Good afternoon. Welcome to the weekly update for the COVID, day 495 and week number 6. I'm joined here today with Chairman Mark Kern and the Director of the St. Clair County Health Department, Mila Blanford. And Mila, another week and more numbers.
Yes, thanks, Herb. Good afternoon, everybody. For July the 15th through the 21st, we have 417 new positive tests out of a total of 4,587 for the reporting period. The age range of those positive individuals was under 10 and in their 80s, consisting of both males and females. The weekly county positivity rate matches the 7-day rolling average, 9.1%. The regional positivity as of July the 18th was at 7.7%. Unfortunately, we do have one new death to report, a female in her 90s with known health conditions. Countywide, we have conducted a total of 388,707 tests, consisting of 32,588 positives and 356,119 negatives. The total number of deaths to date is 486, and our condolences go out to those families. To date, the number of individuals who've completed their 10-day isolation period is at 31,540. Statewide, we've tested a total of 26,444,494. The total positive of that number is 1,404,466, which is an increase of 6,057 since last week. Total deaths to date is 23,392, and that's an increase of 49 since last week. For our St. Clair County hospitalization numbers, we have 28 COVID-related hospitalized patients in St. Clair County, 60 regionally. Patients on ventilators in St. Clair County is 2, and regionally we're at 4. Congregate care for those in outbreak status, we have 3 new locations to report. Caseyville Nursing and Rehab, 3 new cases. Mercy Rehab in Swansea, 2 new cases. In Willow Creek Belleville, 1 new case. Our approach to the pandemic is a 2-pronged approach. One, you have to be tested if you have any symptoms. We have multiple testing options throughout our county. St. Clair Square Mall, Monday, Wednesday, Friday, and Saturday from 8 to 4, as well as CVS, MedExpress, and Walgreens throughout our community. The other approach is vaccine. We offer vaccine 6 days a week through the County Health Department at 330 West Main, Monday through Friday from 10 to 6, and on Saturday from 8 to 4. In addition, we'll be in New Athens on Saturday from 10 to 3. You can go to our website for information on how to sign up for that clinic. We've reached out to all of our local municipalities and gave them information about our mobile clinic sign up. If you're concerned in your community, reach out to your local leader and ask them to sign up for a vaccination clinic. We're still working in conjunction with Illinois National Guard and IDPH to provide those to our community. In addition, IDPH will come down with a mobile clinic if requested. If you are a business owner and you want to provide vaccine to your employees, again, you can go to our website and sign up for that mobile vaccine clinic. We talked a little bit about last week with Dr. Modeman about different vaccine hesitancies and misinformation. One of the things that we commonly hear about kids can't get COVID, they don't spread it. If you go to our website and our social media, we do have the CDC scientific brief out there that gives the rationale between why the states are making decisions in schools and advising with their guidelines. We also offer vaccine to homebound populations. There's no reason if you want vaccine in our community that you cannot access that. If you have any questions about vaccine, call 825-4447 Monday through Friday from 8:30 to 3:30. Okay. Chairman?
Thank you, Mila. Okay, let's take a look at the zip code report. Last week every zip code had COVID positives increases except for 3. This week we only have 2 zip codes without. The spread is ongoing and is happening. 62059 up 2 today to 45. 62201 up 13 to 655. 62203 up 9 to 729. 62204 up 13 to 478, 62205 up 13 to 755, 62206 up 34 to 1,586, 62207 up 19 to 727, 62208 up 32 to 1,871, 62220 up 29 to 2330, 2,330. 62221 up 41 to 3,096. 62223 up 30 to 1,998. 62225 is up 5 this week to 172. 62226 up 45 to 3,577. 62232 up 5 to 972. 62239 up 5 to 529. 62240 up 3 to 182. 62243 up 4 COVID positives to 818. 62254 up 10 to 851. 62255 up 2 to 91. 62257 up 5 to 371. 62258 up 13 to 1,151. 62260 up 1 to 861. 62264 up 5 to 385. 62269 up 42 this week to 3,631. And finally, 62285 is up 3 to 609. Regional positivity actually went down this week. It was 7.8% last week. This week it's at 7.7%. But our rolling average went way up this week in St. Clair County itself, which it was 8% this week. We went up to 9.1%. So we've got a spread going on. The virus has come back much more than it was for a while. We had limited zip codes. If you remember, the numbers were way down. They are now ticking up, and the weekly positivity is 9.1%. Today, to talk about this, we're joined by the ICU Medical Director, Dr. Jigar Hindia, who has been a longtime guest and member of Team St. Clair. Welcome back. We weren't necessarily sure we were going to have you back, but let's talk about what is going on right now in the hospital, and tell me what you're seeing.
Sure. Well, Mark, I'm pleased to be here. I was hoping also tonight to come back to explain more about COVID, but you know, for a while now, for the end of April, May, early June, we were seeing less numbers. We were seeing lower numbers. At one point, we had no patients in Memorial that were positive at all, and that was fantastic. What we're seeing now over the last couple of weeks is a recurrence of positive cases, and as I work in the ICU, we're seeing more positive critically ill patients once again, which we hadn't had any for several weeks.
So the reason for this is people, the main people you're seeing are those who are not vaccinated. Is that correct?
Yes, that is absolutely correct. I think Dr. Bodeman had listed a number of 98% of patients who were unvaccinated that came back to the hospital. Out of our patients, let me rephrase that, out of the patients that are in the hospital that we have with COVID, 98% of them have been unvaccinated, which is a shame. At this point, you know, there really is no good reason to not get a COVID vaccination. And there's a lot of rumors and you know, theories out there that truly are not valid why you shouldn't get vaccinated. This disease at this point is largely preventable, and it is a shame that we have people coming back in that just didn't get vaccinated and unfortunately came down with the illness.
So, Doctor, you know, I know that throughout this, you really gave it your all. You have a family, a large family, and you put your own health at risk early on before there was a vaccination to go in, innovate. We're working with people that had COVID. Now you're working with people who tell you, I wasn't vaccinated. Did they ever give you a reason why they felt it wasn't necessary to get vaccinated? Is there something we can tell people, hey, you know, your belief, whatever the belief is that's keeping you from getting vaccinated is incorrect? Is there any magic word we can use to get people to come in and get the vaccine?
I wish that was the case. So there are a couple of large categories of people who refuse the vaccine, and one is those who don't believe that COVID is a real illness or not a severe illness. One is that category of people who think that the vaccinations are harmful. Those are part of the two biggest camps. So the non-believers in COVID and the vaccine is harmful camp. as far as COVID being a real disease, I think at this point, you can't dispute that fact. We've seen enough cases, enough severely ill patients that there is no way to dispute that that is a real disease and that it can be severe. And the saddest thing is people that come into the hospital who tell you that they didn't believe it was a real disease, and to see them suffering at that time and now realizing that it's real. That is truly a sad thing, because had they just understood or opened their minds to the fact that it's a real condition, they may have been able to avoid this altogether. The second camp is those who believe that it's harmful. And to that effect, the numbers themselves don't lie. There are some adverse events that occur in a rare population of patients, but as a population, the vaccine is far more effective and has much fewer side effects than having COVID does. So those two arguments truly are invalidated in this case.
So hundreds of millions of doses have been given out. 600,000 people have died because of COVID.
6,000.
In the United States.
Yeah, I think it was 0.018%. So
No, I'm talking about overall of COVID dying.
Oh, I'm sorry, I think of the vaccination.
Right, no, not from the vaccine.
If COVID, those numbers themselves, comparably, there's a big discrepancy. The numbers of COVID deaths and the percentage of positive patients have died far outweigh anybody that's been vaccinated that's died. So, the numbers themselves are massive. The numbers of deaths that we have in the United States alone, it's unfortunate, but at this point in time, we have a true toolbox to try and prevent any further deaths. And it is the job of every healthcare provider to try and encourage those out there to take that vaccination, because that is our best tool to prevent any further deaths.
Are you seeing people coming back in so people can rid themselves of COVID, but then the long haul symptoms kick in? Are you seeing people coming back that just have never quite been able to kick COVID, or finding out that later on they had permanent damage, or at least what appears to be somewhat permanent damage?
That does occur. In the ICU, we don't see people coming back in with those symptoms because they're typically outpatients by that point. But I do have friends and colleagues who have had COVID who did have long-term symptoms, long-haul symptoms, things like long-term fatigue, a little bit of shortness of breath that persists, loss of taste and smell that never came back. So that is certainly a real phenomenon.
And COVID-19, the age ranges of people that it affects?
We used to see more people in the older category, 65 and older. The ones we're seeing now are younger, 40s, 50s, who again are in the age range to be vaccinated. But we are seeing younger individuals. Why that is, I'm not quite sure. Maybe that the older population has taken to the vaccine more readily, but we are seeing some younger people currently as well.
There is some have a view on the street that if you're below the age of 16, you can't get COVID. That's not accurate, is it?
That's not true at all. No, the Pfizer vaccination has been approved for younger children as well, for preteens and adolescents as well, the age of 15 and above and 12 and above as well. So those are new categories. I think Moderna is 18 and above, as is J&J. So Pfizer is now advised for those younger individuals as well. It is not true that younger people cannot get COVID. They certainly do. And it's a misnomer. Some people in the younger categories have actually a severe illness called multi-inflammatory systemic syndrome, which can be quite serious. So it is not a truth that people in the younger age ranges cannot get COVID.
So if you're making a recommendation to try to start to get these numbers to go the other direction, what would that be, doctor?
So, if you have not been vaccinated, by and large, that is the biggest recommendation. The biggest risk factor currently that there is of having severe COVID is being unvaccinated. So it is a modifiable risk factor. It means you can modify it by getting the vaccine. I have no personal stake in getting people to take the vaccine, but as a physician, I have a almost fiduciary responsibility to advise that vaccine because it is good for the common goal that we're going for, which is all getting herd immunity to reduce that risk in population. So as a physician, I mean, there is no greater recommendation than getting that vaccination. You know, the CDC has relaxed some of the guidelines for those who are fully vaccinated, which, you know, is really only for that category. And there are those who are unvaccinated who may partake in some of those freedoms. Unfortunately, that is not appropriate for that category of people. But once you're fully vaccinated, you are allowed to have some more relaxations and being unmasked, being out in the public. So by and large, the biggest recommendation, and I can't stress it enough, is to please get your vaccines.
Is this strain that we're experiencing now more contagious and more dangerous than the strain when you were here a year ago sitting at this briefing?
So preliminary data does show that it's more contagious. I think last thing I saw of the Delta strain versus the UK variant, which was the last variant, is that it's 50% more transmissible than that variant was. So it is more transmissible than that variant was in and of itself. And that variant was more, you know, virulent than the prior strain. So we are seeing that it's more virulent. As far as the severity of it goes, preliminary data does show that the Delta strain is more, it can lead to more severe disease than the initial strain as well.
Is this the final strain, or is the Delta strain getting better at what it does?
I mean, viruses, their natural history is to mutate. Viruses want to survive, and they adapt to stressors. And if they can mutate to have a greater advantage to survive, they will. And so this likely is not the last strain. And that being said, the current vaccines we have appear to be effective against the Delta variant as well. The goal being, if we have widespread vaccination and there's less prevalence of the virus in society, that we can minimize the spread and hopefully minimize any further mutations. But if the virus is rampant out there, and they can run rampant, it has more chances to mutate, and then we can't contain it. So the more we can contain the virus by vaccination, the less chance there is of further mutations. But mutations are a natural part of the virus history. It is unfortunately an expected outcome of having a widespread viral pandemic.
So getting vaccinated is not only good for yourself, for your family, but also for the community and for the country as a whole to try to stem the tide of COVID.
You know, yes, and to that point, you know, one other issue with people who refuse the vaccine is the theory of it being somehow, you know, a conspiracy or a government-related issue. It is not. You know, being an American and being patriotic includes helping your fellow Americans. It includes doing things to keep other Americans safe. And there's nothing more patriotic at this point than ensuring that both you and your fellow Americans are safe from this virus. I mean, that to me, I mean, you cannot do anything more patriotic than that. To save your fellow American, your neighbor, your family, that to me is heroic.
Thank you, Doctor. I don't think we could say that any better than what Dr. Hindia just has.
Doctor, how concerned are you about the hospitalizations, the staff? You know, as we talked last week to Dr. Bodeman, you know, the staff went through so much over the last year and a half. They had to be wore out. I mean, how concerned are you right now that there's a possibility we may reach that level?
I am concerned. I mean, it's frustrating because we were doing so well for a while, and none of us really, I think, relaxed enough to think that it was over. But we felt more comfortable with the numbers we were seeing. And to see a resurgence now, and especially in those individuals who it could have been avoided had they been vaccinated, it is certainly frustrating. We're always there to take care of these people. I mean, that is not a question. We'll take care of anybody that walks in the door, and we'll do our best. But it's frustrating to see people who could have possibly avoided this in the first place had they gotten vaccinated. The healthcare workers I work with, the nurses, the RTs, they are fantastic, and they're working so hard. And I know that we all would like to see this just go away. And we're not there yet. And unfortunately, we're heading currently in a backward slide. But we'll keep giving that message that to do your part, please get vaccinated. If you are not vaccinated, have not gotten your full doses yet, continue to wear your mask, distance yourself from people. Everybody, vaccinated, unvaccinated, wash your hands. I mean, those are things that we'll still recommend regardless. But we're hoping that the message takes hold and that the COVID vaccination is more widespread.
Well, and I think one of the concerning parts that I have is that if you go to the doctor, your general doctor, and he says you have high blood pressure and he puts you on blood pressure medication, nobody questions that. Or if he recommends some other type of form of treatment for you, oh yeah, they hurry up and go out and do that. But now we've had yourself, Dr. Bottom, and several other physicians on here that are saying the same message. It's not like you're coming on saying one thing and then another doctor comes on and says another. This message is the same. If we all get vaccinated, we can help be the solution to this problem. And it boggles my mind that people who hear these messages, everybody's got a story where, well, I've talked to so-and-so and they don't believe in it. Just like you said, those two groups of individuals out there. And I hope they don't wait too long until it affects one of their loved ones. And then it's going to be, well, yeah, maybe I should have listened a little bit more. So I think the message today is what we have been saying and we are going to continue to say, go out and get the vaccination. I mean,
absolutely right. I mean, again, none of us have any stake in the vaccines. There's no personal gain here at all. It is a public knowledge we want to impart, which is that there really is huge advantage, minimal downside, if at all. There's no reason to not get vaccinated at this point. Now, of course, talk to your personal physician to make sure there is no overarching concerns. But for the majority of people out there, there is no contraindication to getting the vaccination.
Well, there you hear it. Another of our Team St. Clair members, professionals coming on, spreading that same message that we've been doing and we will continue to do 495 days. As I said, it's just mind-boggling that there are still people out there after we've had 486 of our county residents pass away to this COVID-19, 23,392 people across the state of Illinois. I don't know what picture has to be painted to make that clear that this is a real, true virus out there. You just heard the doctor say, it's real, it's here, it's going the wrong way again. And I'm not saying this for the Team St. Clair members who are out there doing your part, the ones who are helping spread that word. We appreciate that. We ask that you just continue to spread that word to your families, to your friends, to your neighbors, and get it out there, because you heard the doctor say that's the tool in the toolbox that will help us do that. And speaking of that, I just wanted to say right now, this here we received last night from the Greater Belleville Chamber of Commerce 2021 COVID-19 Community Impact Award presented to Team St. Clair. Thank you for your contribution and support. We are thankful for all you have done and continue to do for our community. That was presented to Chairman Kern last night at their annual meeting. Nice picture of the plaque right there. This is for everybody. Team St. Clair and Chairman Kern, I think you said it best last night, we are all in this. It wasn't just one person. It's everybody who's tuned into these briefings daily and now weekly, and everybody who has helped spread that word to all of the physicians, all of the professional people, to the educational staff members that have came on these briefings and tried to get that word out there. School's going to be starting back up. There's a big question about that. I know Mila is pulling her hair out about what's going to happen with that. She was telling me last night that that's a big concern out there. It's a big concern to our families, our parents. So everybody needs to go get vaccinated. It's just that simple. We have made it easy for you. 330 West Main. Don't even have to get out of your car. I don't know how much easier we can make it. So go get it, please. We'll be back next week. And we will hopefully have numbers that will be going in the opposite direction. I don't think we will right now, but we'll see what happens. Everybody have a good night, and we'll see you back here next Wednesday afternoon.